I'm Paula Nutting, your musculoskeletal specialist, and today's video we're looking at how to treat our compressive cervical neck pain symptoms. You'll have clients that will come in to see you who will be complaining of pain when they turn. If they turn head to the right, they'll feel compressive pain on that right hand side. Many therapists don't do compressive work, but it's really quite a good skill to learn. So we treat in prone, but we will assess in supine. To find the facet joints, you're going to palpate the mastoid process of your client. You're going to just go anteriorly and feel down through the soft tissues of the scalenes, the upper traps, deeper through the splenius, and then you'll find the bodies of your facet joints. They will be quite stiff, and our focus is actually trying to stimulate movement and mobility of our intratransversi, the rotatories, the multifidi, all those muscles through there that need to be freed in order for us to get very clean rotational movement of our necks in all ranges. You've established that your client has got compressive neck pain. We need to palpate in supine to get a really good idea on the quality and the integrity of each of those facet joints. So to remind, mastoid process, earlobe, and we're coming down just anteriorly until you find the bodies of the facet joints. Take your time. Palpatory skills are our best tool that we have in our kit, and you're gently going to compress from lateral to medial on one side, so the left here for Ben, and then lateral to medial on the right. So I press probably 2 or 3 times on one side, and then the other. You can press as 5, 6, 10, it doesn't matter. As you're learning, you want to get a good feel, and then you drop down to the next joint inferiorly, compressing lateral to medial, and then we go down again. So you're palpating each of those joints to get an understanding of the quality of all of the cervical joints, and in particular if one is tighter than the other. Now for me, Ben is tighter on the left hand side. Is that the side that you're feeling more? Yeah, so he can confirm it with a subjective pain scale, or just saying yes or no if it feels tighter. We're treating this condition in prone, but you're assessing in supine. You're going to position your client in prone to apply the technique. We're going to make sure that we will affect both sides. There's no point in working one side without working the other, because it's not an effective treatment. The cervical joints will be tender in this move, and the stiffer they are, the more tender, but be comforted in the fact that they will become less painful each time you work through the procedure. We're going to go thumb over thumb, and you're going to palpate till you find that joint, and you're going to gently do a low amplitude move. So it's not a deep, firm, compressive move. It's just gentle, but you're going to feel, once you hit the joint, you're then going to put over pressure. So I'm showing you with 2 fingers, but you're in actual fact going to be on the same side using thumb over thumb. I'm going to work on Ben's side so you can see what kind of movement his neck is getting. It's a gentle rhythmic rocking and tender, yes, Ben? Yeah. From one side, and then we come over and do identically on the other. Pain side?
Yeah, no, that side's fine.
Yeah. At least 10 to 20 times, come to the opposite side and drop down to the next joint. So you can see there's quite a bit of movement, but it's not an aggressive technique. And we come to the other side. Gentle, rhythmic. Find that end point, so sink into the tissue till you find it tight, and that's when you apply the overpressure, so you don't come right off and on, off and on. It's always find the spot where you've reached that barrier, that first tissue thickness, and compress down deeper into it. And we slowly work through the joint ranges. And this feels softer to me. Is it easier to you, Ben?
Yeah, it's good.
Yeah. So you might go through this 3 times to each side. Each time you work through it, I want you to think thumb over thumb, work on the ipsilateral tender side first, then go to the contralateral less tender side second, and you're going to rhythmically go from one side to the other until you've managed to go down most of those joints. With any client that you have that comes to your treatment room that complains of compressive cervical pain on rotation, that is to remember that it's compressive pain on that same side when they rotate. This is an incredibly valuable manoeuvre. Applying it for between 3 and 5 minutes during your technique process, you'll find that will improve 90% of your clients' rotational pain issues. For the other 10%, you might need to apply maybe a stretch or possibly a myofascial release technique, but it is an invaluable tool for you to use. This is the second of our strength components that you will use on a daily basis in our Oh My God, You're a Pain in the Neck and Head series.